So over the years, there's been multiple activities in terms of conference, gathering, bringing people like here today, but also some action plans, vision papers, and really also looking on the networking aspects. This is really a legacy of collaborative leadership, and I'm not talking about myself now. I'm trying to follow in the wake of great leadership over the years, starting with Mayor Ed, who really helped shape the initial structure of ICPerMed, followed by Jan Ivga and Einar as well, with whom I've worked closely for many years, and we'll hear from Einar a little bit later today. ICPerMed is clearly not working in isolation. There's been an ongoing support by the European Commission, and Irene here has been a very strong advocate over the years, and we are thankful of all the activities that have been supported. I can also point out here the lower left corner, the CSA EU Africa, and Monica Frenzel, who's currently leading the international activities of ICPerMed, has been really deeply involved there, as well as Rizwana Mia, who's co-chair of ICPerMed. So it's really a family, and over the years we've evolved, and we are now today celebrating the 10th year of many of these activities. And so that's within the ICPerMed family, but there's also other satellite or like-minded initiatives with whom we've interacted and that contributed to the development of personalized medicine in Europe and beyond over those 10 years. So ICPerMed is, yes, supported both in a logistical manner and financial manner by ICPerMed right now, but there's really a good crosstalk between the two organizations. So while ICPerMed is really supporting funding activities, and as also many other work packages working on developing direct activities, ICPerMed really provide the backbone for policy and strategic perspectives, as well as networking with inter-Europe, but also international partners. So this is really a close collaboration between the two organizations here. I've already mentioned new members from the past years, but we are, again, looking to increase the partnerships of ICPerMed, working with other international organizations also, like Global Alliance for Genomics and Health, and I see Peter here in the room joining us today. So we are in discussions with other organizations having an impact across the globe. So I can mention here also that in the room here and working together closely, there's Rally Silart from Estonia, as well as Rizwana Mia from South Africa. So this really demonstrate and talk about the international aspects of this international consortium in terms of its leadership. And also two working group, and you've probably noticed, but the agenda is really structured around those two working groups. So we'll start by a celebration of those 10 years, but after that, there's going to be a session on the thing, like focusing on the policy, or well, the first one will be the internationalization based on the work from that Monica Frenzel and all the internationalization working group is currently conducting. And the last session will be focusing around the working group policy and strategy, so the think tank of the future, and that's work led by Astrid Vincente and again all the members of that working group. So with that, I will thank you very much, and yeah, hand it over to Jenny to introduce the next speaker.
Thanks, Etienne. So we're talking about local organization, which has been really tremendous in supporting the organization of this conference, and therefore I'm super happy to introduce the first speaker from let's say the Prague organizer, which is Ondrej Slaby. He's the chairperson of the Czech Health Research Council, head of the Center for Precision Medicine of the University of Hospital of Brno. Please. Good morning.
Hello, good morning, ladies and gentlemen, dear colleagues. Thank you so much for invitation. Thank you so much for introduction. It's a great pleasure, and we are really proud to have a chance to host this interesting event. And on behalf of the Czech Ministry of Health and Czech Health Research Council, as I said, it's a great pleasure to host you here. I won't talk about the precision medicine, but a little bit about the Prague and the place we are right now, because you will hear a lot about the precision medicine the following 2 days and personalized medicine. So Prague is sometimes called a city of 100 spires. And it's also a city of 1,000 stories. This is the city of Franz Kafka, Jaroslav Hašek, Václav Havel. And I believe that you already had a chance to feel that every single stone here resonates with the history. It's also a city of the freedom of thought, imagination, inspiration, shaping the future, not only of the Czech people, but in terms of the culture and the science, as you will see later on, definitely worldwide. It's also a symbol of the continuity, the same spirit that historically inspired Tycho de Brahe, Johannes Kepler, or the famous composer Antonín Dvořák. You will see a lot of places here in the town, in the city, in the historical town during your walks, somehow reflecting the history of these people living here in Prague. They inspired not only the researchers today, but also the artists and the whole atmosphere here in the Prague city. We are also very proud on our biomedical or the scientific heritage. Probably you heard about Jan Evangelista Purkyně, who was the one who laid the basis of the cell theory. Definitely, you probably heard about Johann Gregor Mendel, the father of modern genetics. Otto Wichterle, who invented the contact lenses, or Professor Holly, who was the one who discovered a new drugs currently used worldwide to treat hepatitis or HIV. In Czech Republic, personalized medicine and precision medicine is not a vision, it's a daily practice, daily clinical routine. In terms of the precision oncology, we have a huge network of 20 comprehensive cancer centers, providing the cancer care based on the precision oncology principles, based on the comprehensive genomic profiling as a clinical routine. At the same and similar situation is also in the field of the rare and ultra-rare diseases. We are really proud that we have in Czech Republic at our university hospitals and specialized centers, we have 23 out of 24 European reference network centers providing highly specialized and high quality care to the patients with the rare diseases. And when talking about the research, I would like to point out that thanks to the European partnerships, Czech Ministry of Health and our grant agency called Czech Health Research Council currently have a chance to support international projects, consortial projects in various fields of biomedical research. Currently, we are partnering 7 major European partnerships in healthcare and already co-launched 10 international calls within these partnerships, including ICPerMed, when yesterday was opened the 3rd call, as all of you probably know. And we are also partnering this ICPerMed call. So at the end, let me wish you a very productive meeting, inspiring discussions, a lot of new collaborations, and equally also enjoy the beauty of the Prague city and the atmosphere here. Thank you so much for your attention.
And also thanks for having organized the visit at your center, because there will be tomorrow there will be a delegation of ICPerMed going at the Center for Precision Medicine in Brno. So we will actually have the possibility to see the wonderful things you have been doing. Thanks a lot again. And now it is time to call on the stage Pavel Doleček, I hope I'm not butchering your name, the member of the board of the Technology Agency for the Czech Republic and the former Deputy Minister for Science, Research and Innovation of the Czech Republic. Please.
Ladies and gentlemen, good morning, and thank you very much for the opportunity to talk to you, for inviting me. Thanks the host for this great assembly. It was really a pleasure to hear so nice things about Prague from the renowned professor from Brno. This is actually not that common, so that was like Dvorek symphonies to my ears. So Ondrej, yeah, I know it's a hard job to do, but nevertheless, Prague is a beautiful city, and I'm glad that you had some glimpse about it, and you will hopefully enjoy it this day, and also the rest of the Czech Republic in the upcoming days. Nevertheless, when I was asked to speak to you, and I was looking at the partnership and the conference, it's about personalized medicine. I don't know anything about personalized medicine, so I think it would be cool not to talk about it at all. But Ondrej already was before me. He was also not speaking about personalized medicine. What I wanted to mention just briefly is the importance of the partnerships for the Czech Republic, and maybe some travel or the journey that we went through in last years, considering the importance of those types of funding and networking tools. So this is the reason why I would be talking a little bit about the Czech situation and also about the role of Technology Agency, because that's the important part. The Czech Health Research Council and Technology Agency is responsible for all partnership in the position of research funding organization in Czechia. So both of us are representing the whole package, what is Czechia supporting, networking, and participating in. So that might be useful information for the overall picture about partnerships and using those European tools for the benefits of our scientific community, but also for the benefits of the research funding organization, whether it's ministries or agencies, as its example in the Czechia. I'm talking about this because it was not always like that. I remember when I was a couple of years back at the Deputy Minister of the Ministry of Education, Youth and Sports, which is the responsible public body for international cooperation in European affairs. And we were funding those ERNETs projects, and it was quite hard to get our scientific community involved. And it was hard for the ministry to have capacity to be able to organize this, to support this, to be in Brussels, to engage also other ministries, because obviously they are the one with the expertise in the fields, whether it's health or biomedical research or it's material research. So it was very hard to push through the system the importance of partnerships of let's say, ERNETs before that. But throughout, let's say, last 6-7 years, we went quite a journey. And when we are discussing the support of excellent research, when we are discussing about the science for policy concept, the knowledge realization concept, we are now talking about the partnerships as the necessary part of it. And I'm glad that also the Czech Health Research Council, meaning the Ministry of Health, is now participating in the last 2 years much more intensively than we were used to. So this is definitely some pushing up the agenda or mainstreaming the agenda, if I should use the European speak, to our landscape. I'm very, very glad for that, because without the European networks, what's the point of supporting research? Because there's no such thing as a Czech research, obviously, if we are talking about excellence and about something that we want to do. I have 3 slides there. Most of those things would be quite simple or not surprising at all for you, because you are living the reality of partnership, so you know what it's for. But to put those 4 bullets through the Czech system, as I already mentioned, was not that easy. I'm glad that we did that, and obviously I cannot reiterate the importance of the partnerships within the budget of framework program. Hopefully we will see the next framework program and its connections to other, let's say, union-directed programs. So hopefully the partnerships would be maybe remodeled a little bit. Nevertheless, it would be a huge part of the framework program and funding of excellent research on the European level or European scale, if you wish. So the involvement in partnerships, obviously giving the chance to Czech entities participate in international research, which is what we want to do and achieve even more. What is also important, and now I'm talking on behalf of the technology agency, obviously for us as the RFO, it's a huge opportunity to coordinate, to cooperate, and obviously cost some savings. That's the important part of all of it. Nevertheless, we are building the international expertise. It's quite, I would say it's a must nowadays, because when we are talking about the agency or the ministries, whether it's agriculture, Ministry of Industry and Trade, or Ministry of Health, it's necessary to build the expertise within those ministries, because they are the policymakers. They are the one that needs to push the agenda through. They are the advocates and lobbyists for the increase of funding and supporting the funding of the partnerships as such. So it's extremely important to get those ministries involved. Research nowadays is not just about scientists. It's about the whole ecosystem. You need to put the whole ecosystem together. For the beneficiaries, I think there's no need to reiterate this at all, because obviously we all know that. Nevertheless, I just wanted to mention so that you can see the different aspects of beneficiaries and benefits for them in one presentation. And to the end of my presentation, I would just show you what is technology agency doing. This is what is complementary towards the Czech Health Research Council. So you can see those are the running or it would be also ending these ERANET co-funds and partnerships that they are participating. You can see that is in whole areas you can imagine, for material science to quantum technologies, to support of Eurostars or now innovative SME partnerships. It's also about agriculture. It's also about environments. It's all of it, and those are that we are planning to run this year or the next year. You can see that it's no longer ERANET, but there's so-called CSA, RIA, and also new partnerships. So this is something that we are doing at Technology Agency. We are more than happy and more than proud that we can complement the activities of Czech Health Research Council that is obviously responsible for the health or biomedical research in the whole aspect, as you've seen in Ondrej's presentation. So I'm glad that our agencies together are doing something to boost and to foster the European excellence in the research. Hopefully we will be able to do that in upcoming years, and we would have enough funding to do these things properly. And yeah, sorry, so that's the last page of my presentation. Thank you very much for the opportunity. Enjoy.
Thank you very much. And it is really inspiring to see how much commitment you have on these kind of programs, which are extremely important for the research community, but when it comes to personalized medicine, also for patient and citizen. And now, last but not least, I would invite on the stage Alexandru Costescu, Policy Officer of the Health Research on Health Research of the European Commission, DG Research and Innovation. Please come.
Thank you. Thank you very much. And thank you for the very nice welcome from the Czech distinguished representatives. So, ladies and gentlemen, distinguished guests, friends and colleagues, it's a great pleasure for me to welcome you to the ICPerMed and ICPerMed conference on personalized medicine here in the enchanting city of Prague. As we gather in this historic and vibrant capital, I would like to again extend heartfelt gratitude to our generous hosts for offering to organize this international conference in such a beautiful setting. I also wish to thank to the diligent organizing committee and each of you esteemed participants for your commitment to advancing the field of personalized medicine. Looking back at our past conferences, in 2011, 2016, then the ICPerMed conferences in 2018 in Berlin, I think 2021, 23 in France, and to all our projects that we have been funded in this area of personalized medicine. What fueled our enthusiasm for personalized medicine was the strong belief in the long list of advantages that we consider it would bring to the world. We still think it holds true. And moreover, we witness day by day more and more results in this area. However, the journey from promise to results is not without challenges, as we all know. We must address regulatory frameworks to accommodate new personalized medicine technologies while ensuring patient safety. Streamlined approval processes, coupled with rigorous safety protocols, could facilitate the introduction of novel therapies without compromising health standards. Healthcare system integration is another critical area. Personalized medicine demands a workforce equipped with new skills and knowledge. Training programs are essential to prepare healthcare professionals, researchers, and policymakers to incorporate these innovations and developments effectively into clinical practice. Important, we also must focus on equitable access. Personalized medicine should not be a privilege for a few, but rather a right for all. Effort must be made to ensure that advancement in this field reach all individuals regardless of their socioeconomic status or geographical location. Only then can personalized medicine fulfill its potential as a tool for universal health improvement. Policy support as well plays a pivotal role in accelerating personalized medicine transition from promise to results. Encouraging investments in research and demonstrating cost effectiveness will incentivize stakeholders to embrace personalized health solutions. Collaboration across sectors, academic, industrial, governmental, and healthcare will forge pathways for innovation and will drive progress. In this regard, I am pleased to highlight a few policy updates that reflect our shared commitment to advancing personalized medicine. I'm not going to mention the calls that have been launched in 2025. You already know them. What I could single out of this is the European Partnership for Brain Health. It's still under negotiation, so we hope it will be funded and we will start working in 2026 at the beginning. It will be approximately in the same range as the other partnerships. And I think it will offer a lot of possibilities for researchers in personalized medicine area to contribute to mental health and also to addressing neurological diseases. Then for the calls that will be launched in 2026, the Commission has somehow published the drafts. So they are available to you. You already may have an idea about them. There are several calls that are clearly targeting personalized medicine. Now, I would like to mention the European Commission's reform of the EU pharmaceutical legislation, which is still a proposal. It has been published by the Commission as a proposal and is currently under assessment by the Parliament and the Council. We hope it will be adopted in 2026. This reform of the pharmaceutical legislation, which will comprise the regulation, a directive, and several additional acts, aims to modernize regulatory frameworks to accommodate innovation, to put it shortly. And personalized medicine is explicitly mentioned many times. Additionally, among Commission's 7 priorities that you have here on the screen, for the period of 2024-2029, they have been published at the beginning of the year of 2025. The one on sustainable competitiveness underscores the importance of aligning health innovation with broader economic and environmental goals. And here, personalized medicine has a good opportunity to position itself along 3 lines. On the innovation aspect, on the security and resilience, contributing to the efficiency of health care system and their resilience, and also on addressing some environmental aspects. Finally, the life science strategy, which has been published on the 2nd of July, I think this summer, and has been officially launched, let's say, during an event of the Danish presidency at the beginning of October, aims to make Europe one of the best places on the earth to invest in life sciences. As you can see, this area contributes substantially to the research and development budget in Europe, also contributes to the EU GDP, and it's an area where Europe can position itself very well because we have an excellent infrastructure, we have companies working in this direction, and we also have top-class academics and researchers. So life sciences is much broader. It's not only health; it's also food, fisheries, and other life-related, let's say, biomedical sciences, and probably the focus will be on biotechnology. So the life science strategy, which probably will be funded with around 10 billion euros annually for the next 5 years, provides a blueprint for fostering research excellence in biotechnologies mostly and creating synergies across various fields to enhance our collective impact. In closing, personalized medicine is more than an emblem of hope. It is a pathway to better health for all. With commitment, collaboration, and innovation, we can fulfill its promise, transforming the landscape of modern healthcare and enriching lives worldwide. As we embark on this journey of collaboration over the next 2 days, let us celebrate the remarkable achievements and new horizons of personalized medicine. Let us honor the past work of experienced experts here among us and welcome new visionaries among us whose dedication turns scientific promise into reality. Your diverse perspectives and expertise enrich our discussions, accelerate innovation, and fortify our collective efforts to advance personalized medicine. Thank you so much, and may our discussions over the coming days inspire actions that realize the true potential of personalized medicine. Thank you.